If you didn't do the things that I just talked about or we've been talking about, I think you're going to be standing there in the cold with your shirt off, and it's snowing.
Where does the liability lie, right? So if you are using a technology, right, and you are a licensed physician or nurse or healthcare, there are lots of types of HCP out there, right? And you use that AI, and then you are still treating the patient, you're the insured licensed person, aren't you still responsible? And I agree with you. I think it's only a matter of time where someone says, yes, but this tool that I was given and used told me to do this thing that ended up being wrong for whatever reason, or at least is suspected of being wrong. And then the question becomes like, is it the institution that implemented that tool whose job it was to actually vet the tools and make sure that they meet their criteria? Was it the manufacturer, right, of the tool who did or didn't have the training data? And I think it's going to be really tricky to tease all of that apart. But, you know, as I think we know, it'll follow the money in many ways, I suspect, as to like who will be able to provide compensation or remuneration for whatever damage was done. And they will, I think, end up, you know, eventually being the ones who are held responsible because they're the ones who had the most to gain and lose from the matter. So I guess, how do we think about that? Like, is it just too risky, or is there this kind of, again, going back to the tip over point, you know, I think there's certain cases where if you're not using it right now, you might actually end up in the reverse of that problem, where it isn't that the tool was wrong. Someone might come back and say, you should have had access to this tool, or you should have used these tools on my images and my data, because you would have found this thing and you just chose not to do it. And the guys up the street were doing it, and I would have been fine if I was there, but now I'm not.
Exactly. And let's take that one step further in the sort of alternative truth world that we're in. People just take their stories and run with it. So I've been thinking about this a lot, and you're absolutely right. Right now, there are no clear-cut answers. And if someone thinks they have it, they haven't thought enough about it. So I always look outside or look at other areas for guidance. So one of the things that came to mind was the supply chain. So a company like Boeing or any automotive, huge supply chains, like 10,000 players in it. So a corporation is responsible for the ethical behavior of those suppliers in the supply chain. So if you have a supplier who also happens to be engaging in human trafficking, you need to know that. And if it turns out that there's liability, you are responsible for it. So I've been starting to think about where can we borrow from to sort of catch up with the complexity, because these are like matrices on 3D. There's so many data points, and there's only so much that we can do in our human capacity, but AI is going to help us if we do it the right way. So that's what I've started to think about. So right now, and I was thinking about this very point, within let's say a large healthcare system, the responsibility of the CEO and the board is to make sure that all employees are trained appropriately on AI and what it is. They are trained on the ability to speak up. They're given the competency to speak up. And these things are tied to the values of the organization, that hopefully one of those values is patient-centric care. And so if you have those things and you have an adverse event, which you will have, what position were you in? If you didn't do the things that I just talked about or we've been talking about, I think you're going to be standing there in the cold with your shirt off, and it's snowing. The onus is on us, not only to return value to shareholders. I'm never forgetting that. This is not an either or proposition. You need to make money. Please go make money. I believe in ethical capitalism, but do it in such a way where you are embracing the technology and you're also understanding how to mitigate that risk. Don't always worry about where that edge is. The edge will find you. You don't have to go look for it. Just make sure that you're in the middle and you're sturdy in your approach, and give your physicians the level of comfort that you will be with them. We're talking about intelligent failure here. And the intelligent failure is, based on what I understand, this is a good AI tool developed by people with good intent and skill. And this is what the diagnosis is, and this is what the treatment plan is. And if there's really an issue, if it's like it goes from, I'm not sure, to this hits my gut, you stop. And you go get your tumor board together, or you get your colleagues together and you engage. Now, hopefully that's on the, it's a bell curve. That's not that many that are going to do that. But then you know when to stop, and that the pressure isn't so much from a profitability perspective or the insurance. We didn't even talk about that. The insurance pressures, that you have some kind of you have a reliability for those who are involved in the kind of the supply chain of delivering healthcare.
It's interesting. I think about this complexity, and I think you're absolutely right, by the way. People who are not thinking about values and their approach and the change management required, right, in order to do this at the leadership and executive level are setting themselves up for a very difficult position. And I think it comes from the fact that you can't ignore this. There's an inevitability to the application of technology. One of the things I talk about a lot is like, we are so resource constrained, in particular in the healthcare space, based on the demand, right? And our ability to supply quality healthcare is just doesn't, we don't have enough doctors. We don't have enough nurses. We don't have enough hospitals. There's just not enough resources. So we have to solve this technological problem, right, in order to deliver care. And if we're going to solve the efficiency, right, financial complication of the healthcare system, which takes you all the way out to the payers, right, and who's paying for what and what are we covering or not, we should be able to do that and get a higher, better set of outcomes for everybody involved too, because we certainly ethically can't say, great, we can deliver healthcare for everyone cheaply and it's really bad, right? Like you can't go revert. So I think we're just in a very interesting time where we are compelled to apply this type of technology. And I think the people who understand that fact and follow the types of practices that you're describing are the ones who are going to be successful at it, right? And the ones who don't follow those types of frameworks, or who just kind of let it happen to them based on vendor selection criteria, right, are going to be in just a world of hurt, because not only is it going to impact their quality of care, right, and the relationships that they have with their population that they're serving, but they're going to end up, to your point, in financial distress in one way or another.